Hi everyone, I'm Dr. Nonnie. I'm a GP and an author. And those of you who've been following my series would have seen I've done a video about the NHS 411 service who I've been working with during the pandemic. And well, if you haven't seen that video, what are you waiting for? Don't forget to click like and share and subscribe. Well, for those of you who watched the video, the NHS 411 service, you would have seen I really enjoyed the job. But what I found a little bit disconcerting, if I may use that word, is the number of first-time parents, particularly dads, who are calling the service. I mean, for me, I was really, really surprised because not only are they ringing at the weekends, the evenings, but they're actually bringing those little babies in the pandemic to see me at the base and to see my colleagues. I just thought, what on earth is going on here? And one of them said to me, after we had examined the child and found nothing really wrong, said, "Doctor, we just don't know what we're doing." And that just spoke to me. And so today's channel is video is going to be about first-time parents, just to see how we can support them. And to help me unpack this issue and to see how we can best support these parents, I have an expert in the house. So you'll be pleased to hear that I have Mrs Julia Palmer-Ndu. Now, Julie is a registered nurse. She's a health visitor. She's also a mom of 4 herself. So she's been there, done that, not just the textbook folks. And she's the CEO of JPN Training. And she'll be telling us a bit more about JPN Training at the end of the video. Julie, welcome to the show.
Thank you, Dr. Nonnie, and thank you for having me.
Yes. So Julie, for those of us who don't really know what the health visitor is, why have I called you an expert? Could you explain to us what is a health visitor, please?
Yes, sure. So health visitors are actually trained nurses or registered midwives, trained midwives. So we support parents with caring and looking after the children. So the age ranges from birth to 5 years of age.
Right, so really birth to 5 years, because the patients I'm seeing, and my youngest has been 2 days old, but mostly I'm seeing 2-week-olds, 3 week, 10 weeks, a few months. I'm like, why are these people turning up here? Because in the GP practice, normally I wouldn't see them until about 6 weeks when they come for their 6-week check. So for me, it's a bit strange having them so early. So is that because you are skiving, Julie, you and your colleagues, health visitors? Why am I getting your patients?
It's completely far from that, Dr. Nonnie, because what it is, as you know, during the first lockdown, some of the health visitors were deployed into acute settings to help care for COVID patients. So as a result of that, there's been a few of us on the ground. Right. So I could see why the parents, especially first-time parents, needing that support and not getting it. So I guess that's why you've been seeing a lot of them in A&E.
Right, and also another thing that really surprised me is the dads. I thought, is this because it's 21st century? What is it with dads calling? I was always thinking I'm going to be speaking to mom on the phone or mom bringing the child in. But dads are actually, taking part now. Why? What's happening?
Well, there's positives to that as well, because obviously the moms have been quite fortunate having the dads around. Most of them are working from home. So we didn't have that a couple of years ago. So obviously the fathers they've been more hands-on during this whole pandemic and lockdown. So I guess that's one of the reasons why you're seeing more of the dads. But secondly, mothers have been affected. The mental health have been affected because of the whole lockdown and not having that direct contact with health visitors, and particularly around the area of feeding. So most of the moms are saying that they've not had that initial support on the postnatal wards. And quite frankly, the midwives themselves have a lot to do on the postnatal wards. So not being able to offer as much support with regards to feeding as they would have loved to. So I guess that is why you're seeing a lot of the moms and coming in with feeding related issues.
Yes, and the other thing they turn up with I can understand why they will need the GPs when they have the crying infants. So of course we will have things like colic and abdominal pain, and the baby just crying and they can't really settle the baby. They don't really know what to do. And so of course they now think, oh my God, there must be something wrong with the child. There must be something terribly wrong. And then, they need to see a doctor. So they come to see us. And I think also the fact that GP access during the pandemic has also been limited. So I'm not going to just blame the health visitors. I think we as well have not been that available for obvious reasons in the pandemic. So we've identified the problems, the pandemic, new ways of working, less people on ground. I know you are going into patients' homes and still helping now. Just tell us a bit more about what you're seeing on the ground when you do turn up.
Okay, so during the lockdown, seeing patients have been quite challenging for us that go in face to face. Obviously, we have to cope with the heat coming from all the PPEs from head to toe. So where we would love to spend longer than an hour, we allocated mostly an hour for the patients. We end up spending longer because you can't leave a mom who's in distress because of feeding and just leave and say, well, I got to go because I'm sweating under the PPEs. But you want to give the best. So what we see is moms saying that, oh, they don't really know how to breastfeed, or the baby is not getting enough. So I guess if they've had like prior knowledge as well, I think seeing them antenatally really makes a huge difference, because if a new first-time mom takes a baby home, they won't expect a baby to be feeding volumes and volumes of breast milk. So having that initial conversation with them prenatally, I think a lot needs to go into seeing mothers antenatally. So a lot of information can be given beforehand. Remember, when baby is born, there's a lot of oxytocin flying around. So they're not able to retain as much information. So I think that antenatal period is key. So we need to start rolling out antenatal contacts on a universal level.
Yeah, I think you're right, because it seems like, to me, these parents are not well, prepared. And obviously, if there wasn't the pandemic, they would have had the support of friends and family coming in. But that's the exact opposite of what we're allowed to do. We can't really go in to see them and to support them. I think so that suggestion is one thing that we can take away. But the parents who already have the baby, so they've passed the antenatal, they've now gone through pregnancy, birth, and they had the little one in front of them. How can we help them? What do you suggest?
I think, first of all, it's encouraging them to actually focus on their babies. The baby is their manual, to be honest. There's no book that would prepare you for parenthood. So that transition to parenthood is quite a stressful period. But I always encourage them, look at your baby. What have you got in front of you? Study the baby, understand the baby. Babies communicate, they cry. That's the way of communicating. So it's not that you've not cared for the baby or you've not fed them enough. Sometimes they just need that warmth and that love and care and affection. So it's not all about feeding, it's about relationship building as well.
No, you're quite right, because we experience mothers who know that there's a different cry. There's a cry when they're hungry, a cry when they're
Precisely.
wet. So there's a cry for different things. It's like their way of speaking. I mean, I think on a personal level, what I try to do is new moms who I know, I try to sort of call them, reach out to them. So perhaps another way can be maybe faith groups or individuals. If you know someone who's just had a baby, just reaching out to them and just offering that support. I know that some people will say, well, I'm fine, Auntie. So I always get when I call and say, how you get to know I'm fine, Auntie. If you're listening, you know it's you. But I think, if they can speak out and sort of let people know what they're struggling with, I think patients tend to be more open when they're saying, myself, or perhaps someone like yourself, to say, look, the baby's not latching on, or I can't sleep. I mean, I had a mom who, she was so exhausted trying to get her baby to be settled. She fell asleep with the baby and the baby fell out of bed. So, so things like that, just supporting the family. So I didn't even judge her at all. I said, look, I understand that we examined the baby was fine. It wasn't a great drop. So, fingers crossed, everything will be well. But it's just supporting that parents. I think all of us have a job in this, to support people in our community. And so that brings me on to our final question. JPN training. So I know you're really taking this to a new level. The NHS is not enough for you. You've had to go and do this on a bigger scale. So tell us more.
Okay, thank you. Yes, I've always had a passion for early intervention, and I've worked with the NHS. Now I'm doing locum work, but I've always felt that there's more I could give. And I think sometimes I can't go beyond my substantive hours. So I've always thought there's more I can do. So in terms of setting up JPN, it was a passion for me to do over and beyond what I would normally do in a 9-to-5 job. So reaching out to parents, even on the weekends, having phone calls in the evening, doing FaceTime, going to weigh them. I've got myself a scale in the back of the car. So yeah, so JPN training enables me to not only do infant feeding support or supporting new parents, even to just go and sit and listen to them. I could do that now outside of my normal working hours. And JPN training is really about public health in general. So we also offer training to care home workers. So during the pandemic, we rolled out a pilot of, just training care home workers how to self-care, how to, just giving them practical skills of caring for themselves. And when they look after themselves, they're able to give more of themselves to the service users.
Wow, so it sounds like you're very busy. I think our guests will probably have to contact you to find out more about the range of services. So does JPN Training have a website? Is there anywhere we can go to reach you for further help? And perhaps those desperate moms who just want a bit more time and the NHS can contact you privately, can they, as well? So would it be okay to leave your details in the chat?
You can as well, because there's a sister company, www.onestophealthvisiting.com. That's the health visiting side of my training company. So yes, you could feel free to do that.
Wow. Well, thank you so much, Julie. It's been a pleasure talking to you. I'm sure we could go on forever exchanging little stories, but I will just leave it there for now. Keep it short and sweet. Till next time, don't forget to like, share, and subscribe, folks. Thank you.
Thank you so much.